Thanks, Sarah. Good morning, good afternoon, everyone. I'm Wen. I'm the CEO of Smarking. We are a technology company here based in San Francisco, working with parking assets owners, uh, commercial real estate landlords, municipalities, and parking operators, essentially to help them to maximize the business return out of their parking assets. Today, we're very fortunate to have um, uh, very prominent industry thought leaders from the commercial real estate world, Lachlan MacQuarrie from Oxford Properties, the head of platform services, as well as Bob Six, the chief operating officer from Zeller Realty Group, to join us to talk about what is the COVID-19 impact observed so far in their world, and what are some of the best practice they have seen and they have been practicing in terms of reopening and recovery. So with that being said, I'll let our panelists quickly share with us about themselves a bit more about their company and their day-to-day responsibilities. As Sarah mentioned earlier, today we will have prepared questions in the first section, and we'll have questions, open the floor to the audience for questions later on. But yeah, please, Lachlan.
Super. Thank you very much, Wen. My name is Lachlan MacQuarrie. I am the head of platform services for Oxford Properties. I lead a team of subject matter experts in the core operational areas of sustainability, safety and security, smart buildings, smart operations, and customer service, as well as the CMMS platform in our Canadian region. I have global oversight and development of standards, associate assurance, and advisory services for all our assets. And as I steal shamelessly from BASF, I will say that my team doesn't operate the assets, but we help them operate better. Oxford is the real estate investment arm of OMERS Pension Fund, which is the Ontario Municipal Employee Retirement System. It is a $110 billion Canadian assets under management fund, split approximately half between private investment entities and public assets. It's a 55-year-old entity and has about 500,000 pension members. OMERS has diverse interests globally in public investments, infrastructure, real estate, venture capital. And Oxford, where I am the head of the platform services function, is a $60 billion Canadian asset under management firm with approximately 400 assets around the world, 2 million customers, about 100 million square feet of real estate, somewhere around 34 developments today, and about 40 different partners. We own, manage, and develop real estate. We do not do third-party management of properties unless we have a material ownership interest in the assets. And we have a model that follows, I'll call it direct drive, where we're operating, situations where we do third-party, we have third-party managers acting on our behalf, or situations where we have platform models of operations, such as our portfolio in Australia. I'm happy to stop there for a moment and speak about my background a little bit later, Wen, as I hand it over to Robert first.
Thank you, Lachlan. Yep.
Thank you. My name is Bob Six. That's the informal way that I know that you're not a salesman trying to sell me something. I've been in the industry over 35 years. I'm the chief operating officer of Zeller Realty Group. Our CEO would describe me as the person that's responsible for making sure that everything runs flawlessly and smoothly, i.e. the trains run on time. We are a private investment firm that invests money alongside high net worth individuals, as well as investment partners and pension funds. A number of our partners are Invesco Real Estate, State Street, PIMCO, and Partners Group. We have a portfolio that's under management of about $3.5 billion, slightly in excess of 10 million square feet, stretching from Portland on the west to Columbus, Ohio on the east.
Thank you, Bob. So, Lachlan and Bob, could you guys also share with our audience a bit more when it comes to your portfolio? What is a rough distribution in terms of the property types? Is it retail focused? Is it office tower focused? What is the rough kind of distribution? Lachlan?
Sure, go ahead. Sure, thanks so much, Wen. Approximately half our portfolio would be office, about a quarter of it would be retail, and then we would get into a hotel portfolio as well as an industrial portfolio and a residential portfolio. So call that 50-25 and then split amongst the rest. Predominantly about 70% of our portfolio will be North American and about 30% will be European and Asian. That's sort of the mix-up of our portfolio. We would be in Canadian, we call them hockey cities typically, Vancouver, Edmonton, Calgary, Montreal, Toronto. And then when we get into the U.S., we're predominantly located in Washington, Boston, and New York City. And then we have offices and locations in Paris, London, Berlin, and we have a portfolio acquired about a couple years ago that's predominantly based in Sydney and Melbourne, Australia. So those are the core of our assets, I would say.
Amazing, thank you, Bob. How about when it comes to Zeller Realty Group?
We're 100% office. Probably more today, a little bit more of a focus in the CBDs because of the trends. Obviously, because of COVID, and I think the way companies are going to approach their business, will probably be looking to invest more in the suburbs. North America is our where we're invested, primarily currently in the United States, but we have looked in Canada and we've looked in Mexico, headquartered in Chicago, Minneapolis, St. Paul, Milwaukee, Denver, Portland, I mentioned, Houston, Atlanta, Indianapolis, Columbus, Ohio, and I think that about covers it.
Amazing. Thank you, Bob. So thank you both for sharing with us all the context. This really helps our audience to put things into perspective. So for the audience today, we really prepared 3 sections of questions for our panelists. We're gonna ask our panelists to share with us about their observation so far in terms of the COVID-19 impact first, and then we'll let them share with us their perspectives on when it comes to recovery and reopening. What are the things they're seeing? What are the best practices they have observed and practiced? And at the last section, we'll ask our panelists to share with us their view looking toward the end of the year or even coming into 2021, what they're anticipated to see. So with that, quickly, I'll just share my screen to share with everybody from a parking perspective, because we all know to a certain extent parking data reflects the activities of office towers retail as kind of sort of the indicator or barometer of how the consumers are using the commercial real estate, and just see what we're seeing across the board. What is the impact? That is not the one. So as you can see on the screen, what we did is Smarking today, we work with north of 2,000 parking sites across North America. So we were able to, for example, for off-street locations, parking garages, parking lots primarily, we aggregated the data from real-time data from 840 plus locations. And when it comes to, this is kind of sort of year-over-year transactions or activities of off-street parking, contract parking, or monthly parking activities. So primarily, as you can imagine, the tenants in the buildings. Clearly, we can see this is year to date. Before the pandemic, year over year, the parking activities were going up. The business is good, and we're seeing some of the net increase in terms of the utilization of the parking facility. And in turn, we would imagine probably similar when it comes to office buildings, retail buildings. But then once the outbreak of the pandemic hit in the mid of March, pretty much within 1 or 2 weeks, the entire volume of parking activity went down to, and remember, this is just the monthly parkers, less than 25% of the same time period last year. We touched the valley point in the second week of April, so it dropped down to less than 20% across the nation. Slowly, it came back, and at the high point, looks like the last, or this third week of June, we were back at about 35%. And then somehow in the past weeks, we had a bit of a kind of sort of a setback again. So it looks like it's not a straight line going back to recovery. Now, I would say this data may not be, we have bias obviously out of all the data sets because we are using these 840 locations as a pro, but this is what we're seeing. And there is kind of sort of a differentiation when it comes to different regions. For cities like Miami, what we're seeing is when it comes to activities, it's just taking a bit of time. The recovery earlier in the reopening stage, it came back really quickly. For one time, it went back to 60% or more, almost the 65% of same time period last year, which is really good. But yeah, in the past 2 weeks, it came down again. Some other regions not so reopened, but took a little bit of the time. For one example, let's say Boston, it is rather, I'd say, slower, following the national trends, but really just pretty much in line with what we're seeing nationwide. So with that being said, I'll turn off my screen. With that being said, our first question to our panelists is this what you're seeing as well? What is your observation of impact so far? And for this question, we'll start with Lachlan.
Sure, thank you. And when I don't oversee the parking or the P&L side of our business, but I will say, because I've involved in the conversations, that when we look at our assets, most of our assets are located in downtown core CBD areas. And so in many of our Canadian assets, we have significant parking facilities in each building, and we saw that dramatic and immediate decline in terms of our revenue. Almost immediately in early March when COVID was really outed, we saw an immediate shift in terms of occupancy. And so when we look at our buildings, they quickly went to 1, 2, and 3, 5% occupancy rates. And the reality was in most regional and municipal areas, that was guided through public health mandates and orders that essentially limited occupancy in buildings to essential services. We actually, in the course of this pandemic, haven't actually, from an office perspective, closed any of our assets. They've continued to operate. Unlike we've had a few situations where the core of our shopping center portfolio has largely closed down. The buildings continue to operate for essential services, and they've continued to generally remain open. Our hotel assets have particularly out in the west, to the Western Fairmont, like assets like the Banff Springs Hotel, it closed and only really just opened in June. And then, our residential portfolio, people just sheltered in place. But we did see a dramatic, if I think about parking alone, a dramatic change in parking.
Thank you, Lachlan. How about from your end, what you're seeing, Bob?
We have exclusively office assets, and your general numbers across the board are what we're seeing and what we're in fact tracking. I'll give you a data point on a 1.3 million square foot building in Chicago, 311 South Wacker Drive. We have 492 spots. We have, this is Fifth Street Towers in Minneapolis. 492 spaces, 25% utilization. Monthly contracts, we've seen 150 suspensions, and we don't expect to see it move significantly until after Labor Day, and then probably before the first of the year because of winter up there and more people driving. One of the other things that we've seen impact in the interim is people, daily parkers have gone up because people do not want to use public transportation. So to the extent that they can drive in, they are, and dealing with it that way there. The two things, I know that are of interest to you, Wen, and I think to our viewers are not only with the office buildings, the office portion of it, but also the parking portion of it. There is a big push now to go completely touchless with regard to how we interact with our clients. And another one of the big things that has benefited us tremendously to speed the process up and as part of the touchless theme is using license plate recognition. Going to talk about the building that I started to talk about, 311 South Wacker Drive in Chicago. Interestingly enough, one of the things that has saved us there because we are only 24% off, meaning that we're 76% to the good with regard to the revenue in June. I talked to the manager this morning. She was just finishing up her financials. Is the contractors. Through this crisis, contractors have been considered essential employees. So to the extent that there's work being done in the buildings, and from an office perspective, right now our view is spec suites are king. People are looking to do short-term deals and transactions where space is ready made for them. And we've got an ongoing spec suite program that we're working on there. So our contractors have saved us at that asset. Just another data point.
That's amazing. So it sounds like there is the challenge, yeah, but there seems like there is new opportunities as well in a way. So
yes, yeah, absolutely.
Thank you. So Lachlan, Bob, when it comes to the broader impact from COVID-19 to your organizations, let's say commercial real estate, obviously rent is one big component of the entire business. How does that trickle down when it comes to the COVID-19 impact? And financially, even if we look forward a bit, what is your kind of sort of assessment or view on how should we even look at this whole impact from a broader, even rent financial standpoint?
Well, I'll jump in on the office piece of it. I will tell you, not a huge surprise, our CEO became laser focused on our AR early in the process, and we put a SWAT team together with asset management, property management, and accounting, where we were all over the AR, starting with the month of March, because here in Illinois, where we're headquartered, it was really the weekend following St. Patty's Day that Governor Pritzker issued the stay-at-home order. And I will tell you, that effort on our behalf tracks a lot of what we hear from CBRE and Cushman and JLL on a global basis. I mean, we are all into data management and metrics. And so, March, we were 93, 94% pay by the end of the month. By the 15th of the following month, we were 95%. As it relates to March, April, we were 95, 96%. The 3 to 5% that we weren't collecting in most instances were one or two tenants and the retail tenants. Typically, as is the case in a situation like this, it hit the shared office users the hardest, and they are usually the ones that were first to ask for relief. With regard to retail, we took an approach where we knew without office tenants, the retail couldn't survive. We got proactive in terms of dealing with our retailers and really took a hard look at kicking the can down the road, because even now today, with people coming back and 10, 12% occupancy, some of the retailers aren't opening. So we're focusing on supporting them and making sure they can make it to the other side of the rainbow, whenever that is and whatever that means.
I see.
So we
have
go ahead. Yep.
Sorry, we would have a very similar experience with as Bob in terms of our office portfolio. We're certainly today in the very high to mid 90s around rent recovery, and where we are hit, and Bob, you're absolutely correct, is in retail, and that hits us particularly in the urban retail environment, where we have retail as an amenity service across our buildings, and in some cities where we have large path systems that actually connect underground subway systems, or they connect above ground to places like Calgary. Those tenants, we've had to very much work to support them and either defer or abate rent, and we've done that in a very situational perspective. We've probably had 400 some office tenants or office retail tenants ask for rent relief, and in the retail space we're much greater. We've had about 1,600 of our customers reach out and ask for relief, and today our rent collections are probably going to be in the 40 to 50% level at the retail level. Although we are in the midst of negotiating with, our customers on a situational basis. How do we deal with that rent, the lack of rent payment, if it's a deferral, if it's an abatement? And we've had to really put a very formal process together, an intake process, an acknowledgement of the need, gathering information. We don't just automatically accept that they need the relief. We've actually taken time to evaluate it, credit reviews, business analysis. In cases where we have co-ownerships, we're making sure we discuss decisions around what we do so that we don't inadvertently have a situation where we have a vacant space that ultimately we can't easily backfill in this marketplace. And so that governance process, that modified deal process, that we can't forget that we continue to renew tenants and continue to seek new tenants as we go through that process. And so and that's complicated and always confused when you start to think about all the government support relief processes that vary. And those processes vary dramatically in different regions, different countries. And we've got negotiation teams and legal teams and investment teams, looking and amending thousands of leases in the retail space. So it's pretty significant.
I see. So sounds like on one hand, impact, there is a difference when it comes to office, retail, maybe different verticals. On the other hand, what is kind of sort of have been put in place is a rigorous process of working with the tenant, but differently based off the particular situation, and really to trying to work this out together in a way.
Yeah, absolutely. And I think that the nature of our portfolio is we tend to have very strong customers and tenants as a whole. We operate super regional properties. We're not operating small mom and pop situations. And so as a result of that, what we're finding is we probably will have a very high level of success and survival of our customers. The reality of retail in the industry, as it is that in many cases, the retail industry there's segments that have struggled, particularly around the introduction and the evolution of online shopping. And so there are certainly customers that we have had and segments of customers in the industry that have struggled in the environment, even pre-COVID. And so that, having to figure out how we work through that is important. The customers that you're seeing the most impact are obviously going to be F&B, food and beverage, and then that middle ground, that apparel ground that's neither super premium, which surprisingly continues to be strong, but that middle ground apparel, and yet you're seeing surges in areas like healthcare and healthcare related products. So it is quite it's not an equal impact to customers in the retail space.
I see. Thank you, Lachlan. So now we're talking about the impact. Obviously, it's very significant, but there are differences in different verticals, and different things are put in place to try to essentially everybody's trying to survive and come out of this. Now, if we switch the gear a bit, lately, I think it was a few weeks ago, some of the regions started to reopen, and for Oxford Properties Group, especially, it's you guys cover the international market, and obviously different regions, different countries reopen at different time frames. From a reopen recovery standpoint, what has been, let's say, what has been working well from your observation in different regions when it comes to reopen and recovery, and what have been some of the challenges? Yeah, please.
Yeah, absolutely. Well, I think I would say what's working well and challenges. Well, when you think about reopening an office building or a building, first of all, most of our office buildings never actually closed, and I suspect Bob had a very similar experience. And so some of the challenges are we have to first and foremost support our employees to be safe, and what does that look like? And then immediately upon making sure we've got safety in mind for our employees, we have to make sure we put and enable the health and safety of our customers and our assets and our environments. And so that means engaging with our customers, working with contractors and vendors, and it's really meant putting up barriers, building signage, developing protocols on operating practices, establishing rules and regulations amongst our assets around use of masks, temperature screening, health attestations, and of course all this happens at the same time as you're working with local public health authorities. Some of the things that are working well, I think people are listening to public health authorities in most of our markets, and they're wearing masks, they're observing elevator occupancy requirements. It is, however, challenging when you start to think about, COVID hasn't been cured, and we're in the middle of this. And so when a case is discovered in a building, we still have to engage with our customers and communicate that, we have seen a situation of a case on a building, in a floor, and we have to honor the commitment we've made to tell our occupants that we have discovered a case and that we're working with our customers to do deep cleaning. And so some of the challenges, of course, is that cleaning is expensive and it's time consuming and it's fairly stressful. And so those are some of the obvious challenges. The less obvious, or maybe to many on the phone, they're obvious. Planning and prioritizing how we respond to and react to our rules and protocols is certainly challenging. We've got local laws that are changing and are not always the same. And we've got, staff that also have families and considerations to do at the same time. So it's certainly challenging. One of the things that helped us was setting forth, straightforward rules and expectations with our properties and protocols, and then really making sure we follow the lead of public health. We don't want to make decisions that are inconsistent with the local laws. We're happy to follow a higher standard if it makes sense for our portfolio. And we've been very cautious about chasing down technologies that are unproven and rushing out to invest in things that don't necessarily solve ultimately the problem. And then I think that from an operations perspective, making sure our operating teams don't panic. You can't easily treat air. You can certainly fall back on core standards of air filtration, MERV 13 filters. You can certainly make sure you increase the fresh air intake. But in many cases, there's such uncertainty around how this disease spreads and some of the acceptance of that. So we've really had to rely on, straightforward practices that we co-design with our people and that we align with public health.
Thank you, Lachlan. So sounds like it's really working with the local public health authorities and experts, and really do the best to ensure that everything in the building, from elevator to signage to everything, is as thought out as possible. But still, we see challenges, as you said. If there is a case, then it's uncharted water, and how to deal with it, that can be challenging. Sounds like.
Yeah, we put practices in place from early to mid January. We went from having a weekly call to candidly a daily call with operating teams and management team and our operation practices, including our asset managers and our third-party asset managers, since mid January. And we've really used the strength of our experiences together with a varied group of people who offer a perspective, whether that's we have a doctor on staff through OMERS that can guide us through some of the interpretation of healthcare regulation. We have as lawyers in each of the regional areas that can interpret local public health laws. And then certainly we lean on the vast experience of our operating management teams and our site teams in interpreting the best possible protocols so that we set reasonable and fair expectations. Clarity in this time and leadership, that's king for our properties.
Thank you, Lachlan. How about some of the observation on your end, Bob?
Well, we did not have, doesn't sound like we had access to the same resources that Lachlan's organization has, but we're actively involved with the local BOMAs and BOMA International. We took our cues from them. We actually, I mentioned in Chicago, the 21st of March is when the governor issued the stay-at-home order. We actually had spent the previous 3 weeks ensuring we had the bandwidth and the necessary equipment and protocols, for the people so that we could go remote. We went remote on March 16th. We followed the lead of the CDC as well as BOMA International. We had calls every other day. We set protocols in place with regard to how would we handle it, how we would communicate it, because clearly we were in uncharted waters. And what I mean by that is there are HIPAA issues, right? And so, you want to let people know that there has been someone that has either been exposed or reported an infection in the property so that everyone else would know, and that we would execute all of the CDC approved deep cleaning protocols and within the tenant's space. But it also became challenging along the way because of conflicting information. If they hadn't been in the building a week, we had a few tenants push back on deep cleaning because, the information that was out there at the time was such that they didn't feel, according to the CDC's published guidelines, that, well, a week later, there shouldn't be a problem. And so, we ran into a few scuffles, is verbal scuffles, I will say, with some of our tenants, and we forced some issues. They did in fact ultimately acquiesce and understand. It's all about guidelines and protocols, and preparing for those next stages. And so those regular meetings, and we have, it has a different title, but I refer to them as our organizational rules of engagement. It's a living, breathing document that continually changed along the way. And these regular meetings where we had our teams together, so that people knew what was our latest and greatest advice from that standpoint. We never closed our office buildings. We were always open. There was restricted access, to occupants of the buildings, or approved folks who are allowed to come into the property. We as an organization, our controller, our head of HR, and myself worked all through the COVID crisis, probably 70% of the time in the office. We moved our offices in the middle of all this, meaning we went remote on March 16th. We shut our office down on April 24th completely. We were fully remote without a physical location, other than quote unquote cheating in the office of the building, so to speak, in my perspective. And we opened up on June 15th. So, part of it all was, getting ready to come back. We use our rules of engagement and information then to create town hall meetings for all of our properties, so that we could engage with the tenants. Truth be told, one of the things that I thought was funny to me, the tenants were really looking to us for guidance on how they should enter their spaces. And it just never really occurred to me that we would be put in that position. The good news is, we were extremely well prepared. We ran into some issues with some tenants because either the higher ups didn't participate in the Zooms, or the people that did participate in the Zooms didn't report and share with the higher ups what our plan was. The signage is key. We chose not, based on our participation in the National Advisory Council with BOEM International, we chose not to be responsible for taking temperatures. We think temperatures, as an organization, it's an imperfect measure as it relates to whether or not someone can infect, or whether or not they are in fact infected. We have a 6-page we created for ourselves separately. There's it's actually probably more like 3 pages, an addendum to our employee handbook. And the number 6 in my head has to do with, we ask our employees when they work in the office to ask themselves 6 questions every day. One of them is, do you have a fever above this amount? How is your well-being? How are you feeling? If you answer yes to any of those questions, i.e. not feeling well, or have a fever, you are to report to your manager that you will not be in that day, the reason why, as well as HR, and then whether or not you will be working that day, so that we understand, what level of engagement we have with regard to the workforce. So, buildings, how do we get people in the elevators? Things along those lines there are considerations. There is an elevator button that you can buy that lasts for about 90 days that disinfects every time after it's been touched. There are wraps for revolving door handles. There's all sorts of things like that. Lachlan mentioned, use of MERV 13 filters, changing the air more. It's not clear whether, the filter is obviously a good protocol. It's not clear whether or not, from the CDC's guidelines, whether or not these infections are affected by the change of the air, being airborne and things along those lines there. But there's a whole host and list of things that we have either engaged with or we're taking a hard look at. Obviously, building access masks. The one thing that requires a lot more research on our part is the use of UV lights, just because of the negative impact. There are some variations of those lights that can in fact be used, but then the question gets into the cost and retrofits and things along those lines there. I will
we had the same thing, Bob, and we chose on the UV lights, generally speaking, and we often have a decentralized environment in which we operate, but I've been pitched ideas around UV for escalator handrails, for instance, and candidly, our consultants have said to us, you do know that the speed at which the handrail actually operates is in excess of the ability for the UV light to actually do anything. And we've seen situations like that where we've been pitched technology that candidly is not proven. And in other cases, you talk about fresh air. I mean, ultimately, we know that fresh air is better for our customers, and we know that particularly as we're just heading into the summer season, we still have the advantage of, particularly in some of our regions where we have some coolness in the air, to take advantage of increased fresh air turnovers. And if I think back on one of the questions or comments Bob made earlier, we also created a playbook called the Creating Safer Spaces, and we made sure we called it safer because we can't ensure safe for certain, but we can certainly it's safer than normal. And we did a tenant version of that playbook, and that tenant version was distributed to all of our customers. And so we had our own guide, and we had a guide that interpreted for our customers. And most of our sites created videos on how to operate and how to engage with the site when you return to work. And the reality is most of our customers never stop working. They just chose to work somewhere else. And in terms of temperature scanning, what we did as a company is in the office space, we agreed that we would not do temperature screening of our customers. We didn't think that was ultimately an effective use of time or candidly that it ultimately prevented the COVID spread. But we did ultimately land on temperature screening for our employees and for our contractors. And so all our contractors who go into tenant and public spaces have to do a daily temperature screening, as do any of our frontline employees who go into customer spaces. And that was really important for us, more from the perspective of, it just behooves us that we do everything we could do reasonably not to expose our customers to additional risk. And although you could argue, and there's certainly some debate on the effectiveness of temperature screening, and it certainly is not, doesn't capture everything, it was just one more step that we felt that offered a higher duty of care to our customers. And we thought, this is not complicated. And interestingly enough, many of our customers had come to us and say, we hear you're doing some temperature screening. Could we jump in on that with it? And ultimately, we chose not to allow that to happen. Listen, it's one thing for us to take a higher duty of care, but it creates a greater fiduciary responsibility if we're doing it on behalf of our customers as well. So we said, listen, we fully support you, and we can work with you to help find an area, particularly for large tenants who have large populations in a building, to screen particularly if you want to, or we can give you some information on how we do it. And so that's what we've done on temperature screening.
Very fascinating. So, wow, thank you, Jen. So it sounds like on one hand, there has been significant changes in terms of operating processes. And on the other hand, there are activities essentially so it sounds like that was really in the details. The elevators, the air, the doorknobs, everything got to be thought out and figured out. While I heard that both of you are in the boat, let's support the tenants, but there's also a perspective thinking about risk as well, to make sure that things are being thought out, technologies are being tested, or really figured out before things are put into place. Just rush it is kind of sort of a thing. Okay, so now both of you actually touched on the UV light and some other technology. So the question comes to, when it comes to technology, how did that play a role in your continued operations, and especially in this when certain regions reopened? Please, yeah, yeah.
So, I mean,
Could you
I
repeat
would
that question?
say that we need to, I mean, we realize now that because of this, we're not going to get out of this anytime soon, notwithstanding, the media roller coaster ride with regard to a vaccine. And so, germs on a go forward basis, in these types of infections potentially, have motivated us, that our internal task forces that we have with regard to our operations, we're taking that hard look at how do we create a completely touchless experience, right? And so, one of the things that I was involved with our organization was the rolling out of building apps. And so, at 401 North Michigan Avenue, in the midst of the pandemic, prior to people coming back, we rolled out an app. And as part of that, we embedded in it the ability to order food and have it either delivered or have a touchless pickup at the food service operator in the building. And so this concept of I'm sure everyone on their smartphone has had the ad pop up for the key, so you don't need to touch anything anymore when it comes to press a button. We purchased a bunch of those keys for our tenants who wanted them in bulk, and provided them the opportunity to get those. So, I think the one thing that I think is the most profound that we're focused on is the touchless experience.
Wow. Okay. I am impressed that not only the entry exit or the access, but more of if you can order food, that is that
Right.
next level. So, Lachlan, how about when it comes to on your end? What's your perspective on how did technology play a role, or in this continued, operations reopen
Well,
recovery?
I would say, Oxford has had a position for some time and a tactical delivery of smart technology for some time. But I would say that in the middle of a COVID crisis, we didn't necessarily change materially how we use technology. So I would say limited. We've certainly jumped onto some pilots that are using, technology to keep services cleaner for extended periods of time, like Bob mentioned. We are launching an app. We've got some apps in our buildings. We're launching an app that allows customers to adjust the heat and the lights using their phones. They don't have to touch anything. We've leaned into technologies that we already have within our buildings. So, for instance, we've leaned into destination dispatch to automatically regulate elevator occupancy, so that you ultimately, when you go to your floors, it automatically knows that no more than 4 people can go in a cab. And I think that other areas of technology which we tapped into data that we already have that we may not have thought about, using our access scans to figure out occupancy levels in our buildings, so that and that's something we didn't necessarily focus on, but when you start to have a requirement under a public health regulation on a certain amount of occupants in a building, we've had to be able to do that. And then I think you can also use occupancy things like access cards in buildings to be able to regulate when people come into a building. And so that's something that we've certainly had conversations with some of our key customers, and I expect probably those conversations will occur into the future. So when we start to see volumes of people come back in, and yet we won't necessarily see changes to the occupancy numbers in an elevator, we're going to have to regulate to the extent possible when people come through our buildings and lobbies. And so we can use things like technology to give people access or scheduled access intervals or windows that meet the needs of coming in a little bit later, a little bit earlier on different shifts. And so that's a really easy way to enable technology. What it doesn't defeat or doesn't solve quickly is the need to engage with your customer. You have to actually sit down with your customers and actually meaningfully say, notwithstanding what we can do with technology like access control and access buttons and elevators, how can this interact with your way to work? And we expect we can control easily when people come into a building, which is reasonably through access cards and scheduled flexibility. The challenge, of course, when we think about it in a situation where you have limited numbers of people in elevators, when people leave a building. At the end of the day, when someone wants to leave a building, they want to leave the building. And they're going to want to leave a building to get their kid off to whatever baseball practice is still occurring, or whatever basketball practice is still occurring. And so we haven't yet figured out necessarily how to use technology appropriately on the exit side of the equation. On the other hand, we haven't had pressure because most of our customers haven't yet returned to the office place.
So I'll jump in. It's interesting. I have experience with the condo building that I live in, and I happen to be the condo board president. And we went to a protocol of one person per elevator or one family per elevator. And the thought process on that was prior to the implementation of masks. And so, it's really incumbent upon us to inform and communicate and gather information. And so now that in this residential building we've gone to masks, whenever I use the elevator, if someone else has a mask, I will invite them in. And it's really understanding the information. What the CDC suggests, hopefully this hasn't been updated, but what they suggest is infection really occurs with people without masks in close proximity, spending 10 to 15 minutes together, right? And so in my mind, and I've seen this a lot during the COVID-19 crisis. People's common sense seems to have gone out the window. They don't know how to process information. And I say that a little tongue in cheek because, I think about this and it's like, look, if I'm going to be in an elevator with you, right, for 60, 90 seconds, 90 seconds would be a long elevator ride. That would be something like Willis Tower. But if I'm going to be in an elevator with you for 30 seconds and, you are 3 or 4 feet away from me, we both have masks on and we don't touch each other, I think my likelihood of getting, I personally, and I've challenged a number of doctors on this that I know, I think my likelihood of getting infected is pretty close to zero, right? I mean, it's not zero, but it's close enough to that. And so, my earlier commentary is, those are the discussions that tenants are looking for. In our elevators at 401 North Michigan Avenue, we have 3 gray circles in the elevator floors to show people that 3 is okay. We're also restricting access to people with face masks. You can come in the building, you can be grumpy, you can say I'm not wearing a face mask, in which case we will not allow you to enter the building. We have face masks for you, right? And so I think one of the reasons why we gave control of our employees to HR as opposed to their managers was because of issues like these. And when you think of a building, we thought about it. Folks who didn't want to take public transportation, who said, look, I'm happy to take a long walk, but I don't want to work 9 to 5 anymore. And we said, fine, do you want to work 7 to 3:30? Do you want to work 10:30 to 6:30? Because then you're off the main schedule. And I can tell you from, yes, I've done it. I've taken public transportation myself. I don't touch anything. I wear a mask. I can tell you the ridership is maybe 20-25% of what it's been previously. And I don't have any problem social distancing from other people.
Nice.
We very much follow the same thing. We have the same. We have a mandatory mask rule the moment you enter any of our office towers. So you can't enter in, you can't go in the elevator, you can't go into the washrooms without a mask on. And generally speaking, we're finding people adhere to those rules pretty clearly. And then the reality, most of our cities and CBDs also have some form of public transportation. And interesting enough, most public transportation agencies have shifted to mandatory masks as well. So people are becoming comfortable with the new normal, and I like Bob. I don't know if how the science ultimately supports it, but I think that it doesn't, it can't hurt, and it's our best interest as landlords to do what as much as we can to support our customers' health. So,
absolutely.
Thank you, Jen. So it sounds like, yeah, when it comes down to technology, on one hand, there is the consumer experience part, a tenant experience part. There is also leverage in that technology to understand the data, understand how to do better when it comes to all perspectives of management. But also, it really comes down to the basics as wear a mask, make that happen. Probably is going to be a lot more effective. So we have just a little bit of time left. Before we get into the section of looking ahead, what is your anticipation? Could both of you please touch on the topic of when it comes to parking then, in terms of looking ahead, how do you see parking play a role? What is your anticipation or expectation of your parking service and technology partners to enable a good recovery from your perspective?
Well, I don't oversee parking myself, but I will be very brief, and I'll let Bob speak this more. I would say in general, the expectations are help guide us in forecasting. You're seeing numbers that are all over the place in terms of occupancy of our spaces, and help guide us. Give us opportunities to cut costs. Use your expertise in the delivery of services, and we generally outsource parking to third-party providers. Help us guide and cut costs through a very transformative and variable environment. And then devise strategies to help capitalize on revenue for us. Who's coming back? How do we get them? How do we take advantage of the majority of people who are coming back, which are very limited? So that'd be my advice, and I'll flip to Bob.
Thank you.
Yes, absolutely. We're taking a look at other buildings that don't have parking that are close by us, where we have relationships with the managers, and we're leveraging those relationships because we know that they likely have tenants that don't want to use public transportation, that want to come back, and can we, through our parking partner and through our relationship with those other buildings, leverage their tenants with a parking program in the interim basis until things get back to normal. I mean, get back to normal? I think normal, this is the new normal. It might be I remember 9/11 like it was yesterday, and we weren't going to fly again, and all of those other things that were put out there. I think it'll take another flu cycle, late 21's flu cycle, and no uptick late 20 with regard to this, which looks like we're getting a second wave here. So I think any type of a new normal is probably more like 2022. So I think these types of strategies, I think, are really important through our partners, advice from them, recommendations of use of technology. I mean, one of the beauties of license plate readers, for example, is if someone has a monthly contract, the license plate will open the gate. The reader will open the gate for people going in and out. If they haven't paid their monthly bill, it'll restrict their access. Big Brother forces their hand with regard to that. So thinking outside the box in the world that we live in right now, where there are opportunities, we're pushing our general managers, we're pushing our parking partners, and understanding where the opportunities are. Like I mentioned, with contractors, for us in a number of our buildings, that can in fact make the difference. Those folks, typically they're at the building by 6:30 in the morning, right? Yeah. So they're not going to be there all day, and that's sort of like found money. And so from that standpoint, can they be offered a special rate as a contractor that works in the building to make it easier for them, so they're not parking 3 blocks away, to save $3. $3 a day is meaningful to those folks.
Makes sense. Thank you. So it's really that when it comes to parking, provide that guidance, leverage the parking numbers, help the landlords to understand what is the activity. At the same time, discover opportunities for reduce the cost and discover new revenue opportunities. As Bob pointed out, there may be contractors coming into the location. Make sure to capture on those opportunities to from a financial standpoint, at least help from the parking perspective. That is really amazing. Now, quickly, we wanted to get into the look ahead part. Basically, toward the end of the year, coming to next year, we combine all 3 questions into one. What would be your perspectives on what you're anticipating and what's your recommendation to your commercial real estate peers as well as other parking asset owners when it comes to thinking about recovery. And Lachlan, can you start touching on that
Sure,
topic?
absolutely.
Yeah.
We're going to see a mixture of demand in the office space from I'll take more because I want to open up densities to I'll take less because I'm going to work from home. And so I think that you can't unknow that the technology has been able to change how we work from home today. You're going to see an increase and continued focus on health and safety, as we mentioned. And I think that you're going to see the importance of communication with customers continue to grow. I think in terms of advice, keep your customers safe, stabilize your assets and your employees, embrace some leadership, clarity of expectations and rules, and be prepared to be flexible. So that's sort of my quick advice.
Thank you. How about on your end, Bob?
I think a couple of perspectives. I think this is going to create a resurgence in the suburbs because I think a lot of organizations are going to take a look at their space and they're going to want to provide, an example I would give that I expect to see happen that's really anecdotal in my head is somebody that has 150,000 feet downtown probably wants to put 50,000 of that in the suburbs where people can drive in and park. All of us, not just the younger people, want community. The looking back data on working remotely suggests that people aren't as efficient, okay? That's number one. So I think you're going to see a trend there. I will also say that I think a lot of the product that's in the suburbs is functionally obsolete. So I think there's going to be an opportunity for development in the suburbs. There's product out there that it'll cost as much to renovate as it is to scrape. So I think there will be a development opportunity, say 18 to 24 months out for a couple of years. I think the owners that are well capitalized are going to win and win big because I think tenants are going to take a look at their spaces over the next 12 to 18 months. A lot of our users are wanting to kick the can down the road 1 to 3 years because they don't know what they don't know. To the extent that you have the deep pockets to help them with the redo of their space, you're going to be a big winner because the devil you know is always better than the devil you don't know. That's me not really knowing, but spitballing based on what I see out there. And I think office users trying to go from 160 square feet per person to 120, that's no longer the case. And I think what I will think come from this is there will be a lot more office users looking to potentially hotel. But I think the workforce is going to demand 3 days in, 2 days out. I think that'll become more of a norm. I think that flexibility and that opportunity, given this forced upon experiment, people are, I think, excited about that opportunity.
I see. Thank you, Bob. Thank you, Lachlan. So it's really that things are going to continue to change and develop. Really, stay flexible, stay on top of things, and make sure that we're being adaptive. Essentially, is kind of sort of the direction. Thank you both so much. I know we're at the 11 o'clock mark already. We'll make sure, and my apologies to the audience for not being able to take care of the questions today, but we'll make sure to send the questions to our panelists and they will comment on it, and you will see it in our recap note with the full recording. So I wanted to thank the panelists again for joining us. This is amazing. Really appreciate your time and insights. In the next coming days, we will have more sessions like this. For one example, next week we have a industry showcase, 5 minutes back to back, letting all the technology solution providers put it into one session to share with the entire industry what people are thinking in terms of parking could do. So it's on our website. Please feel free to reach out. check it out, and then sign up the newsletters. In our recap note, we'll share the LinkedIn profile and email with of our panelists as well. So if you have continued questions, please feel free to reach out. Okay, thanks everybody. Thank you, Lachlan. Thank you, Bob.
Thank you.
Thank you, Wen. Appreciate it.
Thank you very much. Yeah.
Nice to meet you digitally, Lachlan. Take care.
You too, bro.
Bye-bye.